Early signs labor is near, but hasn't started yet. Look out for these very early signs of labor, also known as pre-labor symptoms, which can happen anywhere from a full month or more to a mere hour or so before active labor starts. Baby drops. If you're a first-time mom, expect your baby to drop, or descend into your pelvis, a few weeks before labor begins, usually around 2 to 4 weeks before, but it can vary. In subsequent births, this lightening doesn't often happen until you're truly in labor. Your baby is getting into position to make his exit, ideally with the head down and low, and not in the breech position. You might feel like you're waddling even more than you have been up until this point, and you may still be experiencing frequent urination like you probably have been in the 3rd trimester because baby's head is now pushing down on your bladder. The good news is that you have a bit more breathing room, since your little one is moving away from your lungs. Cervix begins to dilate. Your cervix, too, is preparing for birth. It starts to dilate, open, and efface, thin out, in the days or weeks before you deliver. At your weekly checkups in the home stretch of your pregnancy, your provider may measure and track dilation and effacement via an internal exam. But everyone progresses differently, so don't be discouraged if you're dilating slowly or not at all yet. Cramps and increased back pain. You may feel some cramping and pain in your lower back and groin as labor nears, especially if this isn't your first pregnancy. Your muscles and joints are stretching and shifting in preparation for birth. Loose feeling joints. Throughout your pregnancy, the pregnancy hormone relaxin has made your ligaments loosen up a little. It's also responsible for your potential bouts of clumsiness this past trimester. Before you go into labor, you may notice that the joints all over your body feel a bit less tight and more relaxed. It's just nature's way of opening up your pelvis for your little passenger to make his way into the world. Diarrhea. Just as the muscles in your uterus are relaxing in preparation for birth, so too are other muscles in your body, including those in the rectum. And that can lead to pre-labor diarrhea, as if the ongoing pregnancy diarrhea you may have experienced wasn't bad enough. Though annoying, it's completely normal. Just be sure to stay hydrated and remember, it's a good sign. Weight gain stops. Pregnancy weight gain often levels off at the very end. Some moms to be even lose a couple of pounds. This is normal and won't affect your baby's birth weight. He's still gaining, but you're dropping due to lower levels of amniotic fluid, more bathroom breaks and maybe even increased activity. Fatigue and the nesting instinct. Wait a minute, is this the 3rd trimester or the 1st? Between the active bladder and the renewed fatigue, sometimes you can feel like you've traveled backwards in time. That supersized belly, along with your compressed bladder and other organs, can make it tricky to get a good night's sleep during the last days and weeks of pregnancy. So pile up those pillows and take naps when you can, if at all possible. That is, unless you're feeling the opposite of super sleepy. Some moms get a burst of energy, also known as the nesting instinct, as their baby's birthday nears, and can't resist the compelling urge to clean and organize everything in sight. That's okay too, as long as you don't overdo it.